Hello everyone, I'm Dr. Chen Yen-Ting. Today, I'm very honored to introduce our ophthalmology department of Linkou Chang'an Memorial Hospital. First, let's look at our service value. We have around 16,000 patients in our OPD and 600 patients in our ward per month. About surgery, we have around 1,400 cases per month, which is over 50 cases per day. Currently, we have 33 attending doctors in our department, 8 of them in general ophthalmology, 5 of them in oculoplastic, and 5 of them in glaucoma, 6 of them in cornea, and 9 of them are retinal specialists. Currently, we have 3 fellow doctors and 14 resident doctors. About the academic titles and ranks, we have 6 professors, 6 associate professors, 10 assistant professors, and 5 lecturers. Now, let me introduce our general ophthalmology. Our general ophthalmology can be subdivided into neuro-ophthalmology, refraction, and pediatric. Neuro-ophthalmologists are specialized in diplopia, optic neuropathy, strabismus, and retinoblastoma. Refraction specialists are specialized in eyeglasses prescription, orthokeratology, cataract, and refractive surgery. And pediatric ophthalmologists are specialized in children's vision care, pediatric strabismus, and orthokeratology. About cataract surgery, in our department, we have precision cataract surgery with premium IOL. With the help of eye design, Pentacam, and eye trace, we can now calculate the most suitable IOL for our patient. As for myopia control, atropine and orthokeratology is now widely used in our department. We also have a vision rehabilitation center for those low vision patients. Rehabilitation includes visual function assessment, enhanced light perception, enhanced visual development, and learning to use low vision devices. We also have international medical service for those low vision patients. About strabismus surgery, in our department, we have minimal invasive strabismus surgery, which has a smaller wound and a faster recovery. About retinoblastoma, our department is the only retinoblastoma center in Taiwan. Next, I will introduce our oculoplasty. Our oculoplasty is specialized in deacrylcytorhinostomy, eyelid beauty and cosmetic surgeries, thyroid eye disease, orbit and eyelid tumor, and also ptosis correction. In Taiwan, we have achieved top 1 endonasal deacrylcytorhinostomy, lacrimal duct reconstruction, orbital eyelid tumor excision, and congenital ptosis correction. Our oculoplasty also collaborate with retinal specialists in implanting retinal prosthesis like August 2. Endonasal DCR is a new technique in treating lacrimal duct obstruction. By using the endoscope through the nasal cavity, we can create the deacrylcytorhinostomy inside the nose without creating the wound outside. We also devoted an orbital navigation system, which can make surgeries like orbital decompression, small intraorbital tumor, intraorbital foreign body safer. We also have lacrimal ductal scope, which is a very thin fiber scope that can pass through the lacrimal duct and let us see what is happening inside. Next, I will introduce our cornea department. Our cornea department specialized in refractive surgery, dry eye disease, ocular surface disease, corneal neurotization, tissue engineering, and corneal transplantation. About refractive surgery, currently we have PRK and LASIK using the femtosecond laser in the eye design. About dry eye disease, except for those traditional treatment, We also devoted in the development of autoserum, amniotic membrane transplantation such as Pokera, and also intense pulse-light therapy. Intense pulse-light therapy is a new application in treating meibomian gland disease of dry eye patients. And with the help of autoserum, the patient with persistent epithelial defect can finally get healed. Corneal neurotization is used in patients with neurotrophic corneal ulcer. The surgery will take the patient's suture nerve from the patient's leg and insert it into the cornea, thus restoring the corneal sensation. About corneal transplantation, we have around 80 to 90 cases per year. Most of our corneal transplantation is the penetrating keratoplasty, and we also have done DALK, DSAK. In 2020, we have around 20 DMAK cases, which is the newest endothelial keratoplasty technique. Next, I will introduce our glaucoma department. Our glaucoma department specializes in the early diagnosis of glaucoma by using the OCT, wide-field OCT, OCTA, and autoperimetry. We have also devoted in developing new medications. We also have minimal invasive glaucoma surgery, like eye stent. About perimetry, currently we are developing a VR eye tracking perimetry system. Trabeculectomy is an old standard glaucoma surgery for decades. However, it has high complication rate. With minimal invasive glaucoma surgery, such like eye stent, it has a small wound and shorter operation time, which is safe with a lower complication rate. However, it is highly surgical technique demanded. Currently, we have over 30 of eye stent cases in our department. About eye tracking perimetry, if the patient moves his or her eyes, our system will detect the eye movement and move the stimulus simultaneously. Next, I'll introduce our Retina department. Our Retina department is the International Retinal Teaching Center. We have international fellows from many countries every year. In our Retina department, we have sweat source OCT, OCT angiography. You can see various of retinal diseases here. We also have Argus 2 Retinal Prosthesis Center and Artificial Intelligence Training Program. OCT angiography is a new technique that we can observe the retinal vessels from superficial to deep. In our retinal department, we have very strong team in retinopathy of prematurity, endophthalmitis, trauma, uveitis, macular surgery, retinal detachment, IOL fixation, and retinal prosthesis. Chang'an Memorial Hospital is the first Arcus 2 center in Asia. We have our first case in Asia, and currently we have 13 cases of Arcus 2 implantation. When compared to other ophthalmology departments in Taiwan, we have the top score compared to other hospitals. About publications, our department is outstanding in Asia and non-inferior to other large centers in Western countries. About our training program, we have a subspecialty-based learning. You can choose general ophthalmology, oculoplasty, cornea, glaucoma, or retina for 1 or 2 weeks. I believe you can learn a lot from our subspecialty in this 1 or 2 weeks. The advantage of choosing our department is that we have a very international environment. We have held many online meetings with Japan and Malaysia. We also have many international fellows every year. In our department, we have an English teaching environment and an all-in-English morning meeting. You can see large amount of surgical cases and large amount of rare diseases. We also have very friendly colleagues and welcome you to join us. Thank you for your attention.